we are going to discuss something about quadratus lumborum block. The this is the recorded video. So this is the transverse process. This is the body of the vertebra. So above the body, inside, this side is the abdomen. This side is the abdomen. So it's the psoas muscle. This is the quadratus lumborum muscle. My needle is coming, and I'm trying to deposit in between these two muscles. So once I get the plane, I'll go back. I've started getting the plane between the quadratus lumborum and psoas. So this is too much posterior. You do not need to come. So you can deposit even here. Some people say quadratus lumborum 1, 2, 3, 4, 5, whatever. So this is in between. There is supposedly the nerves are there. The posterior tap, some people they say, to catch those nerves before it gets anterior and posterior cutaneous division. So this is from from medial to lateral. My needle is coming. Here is those. If you can imagine, here is those external oblique, internal oblique, and transversus abdominis muscles are there. So I am coming from medial to lateral. All right. Now you'll see from those posterior to anterior approach. This is one more. This is the same transverse process. Okay. Let me check. All right. So this is the transverse process. We brought it to the center. So this is the quadratus lumborum muscle. This one. And this is the psoas. So this is the body of the vertebra. This might be left or right side, depending upon the aorta or inferior vena cava. Okay, so my needle is coming there, and this is the anterior most part of the quadratus lumborum muscles, and after this it is transversalis fascia. So needle take me somewhere there. We'll go to the second video. I have injected some of the anterior most part of the quadratus lumborum muscle, psoas, quadratus lumborum, transverse process, vertebral body. All right. Here are the erectors. All right. So this is the perinephric fat, or whatever you can say. The transversalis fascia here. All right. Okay. And the local anesthetics getting deposited anterior to quadratus lumborum muscle, and top of the psoas. This is psoas, this is quadratus lumborum, and the local anesthetics are very much there. So probably one of the roots started getting visualized, may or may not be, but this is the QL1, you can say, anterior most part of the quadratus lumborum muscle. So this is quadratus lumborum, transverse process, vertebral body, in between that is the psoas, and this is all about the quadratus lumborum block. I think somebody might have noticed the kidney here, just to show again. In the initial part, probably this is the kidney. Okay, so we are much below the kidney, avoiding the kidney. This is the video to and fro, from the start till end, it's getting repeated. So this is my posterior to anterior approach of quadratus lumborum block. All right. And this is where the liquid is, local anesthetic is already deposited. Okay. Psoas muscle, quadratus lumborum muscle, transverse process, vertebral body, inferior vena cava or aorta, depending upon the site you are doing. Okay. Let's see how many people are getting it.